It's the same story every evening. You get home from the grocery store, you kick off your shoes, and you notice it again, that deep pink line where the top of your sock was pressing all afternoon. Your ankle looks a little puffy, a little tight. You press your thumb on it gently, and a soft dent stays there for a few seconds before the skin springs back. And you tell yourself the same thing every senior tells themselves. It's just my old veins. But here is what a 542 patient cardiology study out of Japan found that almost no doctor is telling you at your appointment. That evening puffiness is not your veins. That is your heart, quietly asking for help. And the third finding I'll share with you tonight from a MESA study of nearly 7,000 adults is the one that made me sit down when I first read it, because it shows this exact pattern appearing 3 to 5 years before a doctor ever puts the words heart failure on a chart. I'm Dr. Ember. I'm a health educator focused on senior wellness, and I have spent years reading the studies that get buried inside academic journals, the studies your family will never hear about at a 15-minute appointment. What I share with you at the 14-minute mark tonight will change everything about how you look at your feet at the end of the day. And stay with me until the end, because there is a specific 5-second test you can do at home tonight, standing in your kitchen, that will tell you whether your heart is quietly slowing down years before any stethoscope catches it. Let me start with a picture. Imagine your circulatory system is a shipping company. Every heartbeat is a truck leaving the dispatch center. The dispatch center is your heart. And every truck carries fluid, oxygen, and nutrients to every warehouse in your body. When dispatch is running strong, the warehouses stay clean. Packages arrive, packages leave, the system flows. But when dispatch slows down even a little, even before anyone at headquarters has noticed, something happens at the warehouses farthest from the center. The ones at the very bottom of the map, your ankles, your feet. Packages start piling up there because gravity is pulling them in, and dispatch is no longer strong enough to pull them back out. That is what pedal edema is. It is not a plumbing problem with your veins. It is a scheduling problem with your heart. Now here is what makes it truly telling. During the day, gravity fills that warehouse. But at night, when you lie flat, gravity releases its pull. The fluid drains back toward the center. Your body works overtime through your kidneys to flush it out while you sleep. So by morning, your ankles look normal again. You look in the mirror and think, I was fine after all. But this pattern swelling by evening, gone by morning, is the exact signature the researchers documented in the earliest stages of heart failure. Before the wheezing, before the shortness of breath, before the chest tightness, just a sock line at 5 in the afternoon. Here's what most doctors will tell you when you finally bring it up. It's just your age. Wear compression socks. And that single sentence has cost tens of thousands of American seniors an early diagnosis they could have had years sooner. Because ankle swelling that follows the 5 p.m. rule bilateral, symmetric, gone by morning is not a wear and tear symptom. It is a warning shot fired from your heart to your feet. And there is a 5-second test you can do tonight before you go to bed. That will tell you whether that warning is worth acting on this week. So here is what we're going to cover together, step by step, in the next 17 minutes. 5 findings. Every one of them drawn from published cardiology research. Every one of them the kind of thing you wish someone had told your father or your husband 5 years before the diagnosis came. And near the end, one number from a study of nearly 7,000 adults that stopped me cold. I promise you, you will want to write it down. Type the number 1 in the comments right now if you notice your ankles or feet swelling by evening. Just the number 1. So the algorithm knows to send this video to another family whose father is quietly hiding a sock line under his socks. Point 1. The 5 p.m. rule. In 2013, Dr. Hajime Kateoka in Japan published a study in Clinical Cardiology of 542 patients evaluated for leg swelling. And what he found rewrote how cardiologists think about ankle edema. Mild pedal swelling, the kind most people ignore, was present in a substantial share of patients who were technically in stage A or stage B heart disease. That is the pre-symptomatic stage. That is before anyone has called them a heart patient, before any hospital admission, before any prescription. And the telltale pattern was this. The swelling came by late afternoon. It got worse by dinner. And by morning, it was gone. That is called fluid redistribution, and it is not a venous problem. Venous swelling, the true varicose vein kind, does not usually resolve overnight. It stays more or less all day, every day. But cardiac fluid redistribution obeys gravity in a very specific way. Upright, all-day fluid pools. Lying down all night, kidneys flush it back out. And here is the number I want you to write down. In the Kateoka study, the patients whose evening swelling followed this exact pattern had measurably higher NT-proBNP levels, that's a blood marker of cardiac stress, than those with no swelling at all. Even though nobody had told them yet they had heart disease. Their hearts were already speaking, just nobody was listening. So here is your first observation for the week. For the next 3 evenings at 5 p.m., look at your ankles. Not casually, really look. Do the sock tops leave a line? Is one ankle bone less visible than the morning? Is your shoe tighter than it was at breakfast? If yes, write down the date. Because that pattern over 3 consecutive days is worth a phone call to your primary care physician. Point 2, the sock line test. And I want to teach you this one carefully, because it's the single most useful thing you can do at home tonight. Sit down in a chair, pull off your sock, and press the pad of your thumb firmly but not painfully into the front of your shin about halfway between your knee and your ankle. Hold it there while you count out loud. 1, 2, 3, 4, 5. Now release. Look at the spot. If the skin springs back immediately, you have no significant edema tonight. Good if a dent stays there, a visible depression that lingers for more than 20 seconds. That is what doctors call pitting edema. And pitting edema in a senior over 60, especially when it follows the 5 p.m. pattern, is one of the earliest measurable signals of fluid retention that heart failure clinicians teach medical students to look for. Now here is the second half of the test. Note the depth. A dent of about 2 millimeters barely visible is called 1+ pitting. A dent of about 4 millimeters, the width of a thin pencil line, is 2+. A dent that stays for over a minute is 3+. And a deep dent that stays for 2 or 3 minutes is 4+. If you find yourself at 2+ or above 3 evenings in a row, that is not a wait-and-see situation. That is a phone call this week. Bring these words. I have bilateral pitting edema of the lower extremities that resolves overnight. I would like a cardiac workup, including NT-proBNP and a bedside echocardiogram. Write it down. Read it if you need to, because the specific words matter. Those words move you from her ankles are swollen to she needs a workup in the medical record. And the difference between those 2 sentences is often the difference between catching it now and catching it in the emergency room. Before we go further, type the number 1 in the comments right now if this is landing. Not for me. For the algorithm. So this video reaches the next family before their year 5. Point 3, the signal hiding inside your bathroom scale. Remember our metaphor. The shipping company where the dispatch center is slowing down. Well, here is a third picture that captures this even better. Imagine your body is a bathtub with a slow drain. During the day, you pour water in through what you drink, through the fluid the body itself produces. At night, the drain works to empty what is not needed. In a healthy heart, the tub empties overnight almost completely. In a heart that is starting to weaken, a little water stays behind every night. Not much. 200 milliliters, 300, not enough to see in a mirror. But your bathroom scale will see it. Here is the number cardiologists teach their patients. A weight gain of 2 to 3 pounds in 3 days with no change in diet is roughly 1 liter of retained fluid. 1 liter. That is a full water bottle, sitting somewhere inside your legs, your abdomen, or worse, the tissue around your lungs. And you cannot feel it until it is far advanced. So here is your action step. Starting tomorrow, weigh yourself every morning, same time, same amount of clothes, right after you use the bathroom before breakfast. Write the number on a piece of paper taped inside your bathroom cabinet. This takes 7 seconds a day. And it is one of the single most effective things a senior can do to catch a failing heart before the emergency room does. If you see a jump of 3 pounds in 3 days and you did not eat a salt-heavy meal, do not wait. Call your doctor's office that morning, because at that point, the fluid is already collecting somewhere that matters. Point 4. The MESA finding the one I promised you at the start. In 2016, a research team in the United States published data from a study called MESA, the Multi-Ethnic Study of Atherosclerosis. This was not a small study. 6,814 adults, ages 45 to 84, followed over years. And what the researchers did was simple. At the start, they asked a single question. Do you have swelling in your ankles or feet? Yes or no? That was it. And then they watched. Over the years that followed, they tracked who developed clinical heart failure, the diagnosed, hospitalized, on medication version of heart failure. And the people who had said yes to that one question at the start, even after the researchers adjusted for age, weight, diabetes, and diuretic use, those people were significantly more likely to end up hospitalized for heart failure. That single self-reported symptom swollen ankles predicted the future course of their hearts. And here is what struck me when I read the MESA paper. The signal did not require an EKG. It did not require an echocardiogram. It did not require a hospital visit. It required a person at home looking down at their own feet at the end of the day and telling the truth about what they saw. That is it. That is one of the most powerful, cheapest, earliest heart disease screening tools we have. And most families never use it because nobody told them the sock line meant anything at all. Before we get to point 5 comment, which of the first 4 steps you are going to try first? One word. Sock, scale, test, words, whichever one you are committing to. One word. Point 5. What to actually ask for at your next appointment. Because seeing your doctor and describing puffy ankles, that gets you sent home with compression stockings. What we want is a proper cardiac workup. And that means specific tests requested by specific names. Write these down. Number 1. NT-proBNP, sometimes written BNP. It is a simple blood test, $20 in most labs, 10 minutes to draw. It measures a hormone your heart releases when it is stressed. If your NT-proBNP is elevated even mildly, that is objective evidence your heart is working harder than it should be, not a guess. A number. Number 2. A bedside echocardiogram. This is an ultrasound of your heart. Painless, non-invasive. 20 minutes on a table. It shows exactly how well your left ventricle is pumping. The measure is called ejection fraction, and it shows whether your heart is thickening or dilating. A normal ejection fraction is 55% or higher. Anything under 50 is worth a cardiology conversation. Number 3, basic labs. A metabolic panel to check your kidney function because your kidneys are the ones flushing that fluid overnight, And if they are slowing, your heart is having to work even harder. And your electrolytes, especially your sodium and potassium, because a low sodium is often the first blood work sign that the body is retaining too much fluid. Ask for these 3 things by name. And if your primary care physician hesitates, and some will, because Medicare has learned not to overtest, bring the specific pattern in writing. I have bilateral evening pitting edema that resolves overnight, along with a 2-pound weight gain over 3 days. Those specific words open the door for the tests. Vague words close it. Now, the finding I promised you at the start, the one that made me stop reading and sit down. 6,814 adults. 1 yes or no question about ankle swelling. Years of follow-up. And the people who noticed the swelling by evening were measurably more likely to end up in a hospital bed with heart failure years before their heart made any other sound. 6,814. That is not a small data set. That is a signal so strong the researchers built an entire predictive model around it. And here is what struck me when I read this study. The researchers did not describe individual patients, but every single number in that data set was a mother, a father, a grandmother, a husband. Every one of them had a family who loved them and who did not know what the sock line meant. The pattern the paper documented was not one bad evening. It was a slow accumulation, a year of noticing, a year of ignoring, a year of blaming the shoes, a year of buying compression socks, and then one Tuesday, a call from the emergency room. In that single arc captures everything. The signal was there. The family was there. The love was there. All that was missing was a video like this one, which is why videos like this one exist. So the next family gets year 1 instead of year 5. Here is the truth I want you to carry with you tonight. In older adults, the heart does not first fail on a treadmill in a cardiologist's office. It first fails at 5 in the afternoon at your own kitchen table when your shoes feel a little tighter than they did at breakfast. Silence is not safety. A quiet body, a quiet symptom, a quiet sock line at the end of the day that is not aging peacefully. That is aging invisibly. And what it needs is not another pair of compression socks. What it needs is you pressing your thumb into your own shin and counting to 5. Let me leave you with the 5 findings cleanly so you can share them tonight. 1. Evening ankle swelling that resolves by morning is a cardiac fluid redistribution pattern documented in Kataoka's 2013 cardiology study, Not Old Veins. 2. The sock line test thumb into the shin, count to 5. Watch for a dent that stays past 20 seconds is a home version of the pitting edema check heart failure clinicians teach medical students. 3. A 2 to 3 pound weight gain in 3 days without diet change equals roughly 1 liter of retained fluid. Weigh yourself daily and log it. 4. The MESA study of 6,814 adults proved that self-reported ankle swelling independently predicted future clinical heart failure. This is one of the cheapest and earliest cardiac screening tools you have. 5. When you call your doctor, use the specific words bilateral pitting edema, resolves overnight, and ask by name for NT-proBNP, a bedside echocardiogram, and a basic metabolic panel. And if all of this feels like too much, I understand. So pick just one. If I had to choose one action for you tonight, it would be this. At 5 o'clock this afternoon, before you take off your shoes, look down. Really look. Notice whether your sock tops have left a line. If they have, press your thumb into your shin for 5 seconds. Watch for the dent. Write the date on a calendar and note what you saw. That is it. One glance, one press, one line on paper. That single evening habit has helped catch more early heart failure in the published research than any single medication I could ever recommend. And it costs nothing. Not a copay, not a coupon, just 5 seconds and honesty with your own body. If this video helped you, or if you can think of one family who needs to hear it, please share it. That is how families get the warning nobody sends in the mail. Comment below with the one word, the action you are taking this week. Sock, scale, test words, subscribe to the channel, because next week I'm covering the specific overnight sleep pattern that predicts stroke risk 3 years before symptoms, a pattern most families dismiss as ordinary aging. And if you missed it, watch my last video on the 6-year Alzheimer's warning hiding in your parents' mailbox. It is linked below. Every video on this channel is here for one reason: to give families the warning nobody else does. A quick note before we end: I am a health educator, not your physician. Nothing I share on this channel is a prescription or a diagnosis. It is research translated for families so you can walk into your next appointment with better questions. Never start, stop, or change a medication based on a YouTube video, including this one. Please always consult a qualified healthcare provider who knows your full medical history before making any changes. What I share here may help you notice earlier and ask better questions. It cannot and does not replace the physician who examines you in person. Thank you for spending this time with me tonight. Stay safe, stay curious, and I'll see you in the next video.